The first step in successful clinical endodontics is to decide what tool to use, why, where, and how. Hello everyone, my name is John West, and I'd like to welcome you to this presentation, ProTaper Next. You know, as a clinician and an educator for the last 35 years, I'm always curious to know what the students' main questions are. And it always comes down to one main question. And how do you make those shapes? How do you make consistent shapes? And how do you build a system that is transferable so that I can do it too? Well, most of you that know me know that I always like to start with the answer. And in order to start with the answer, let's look at today. What are we doing now? What are we capable of doing? So on Monday morning, you're going to see this patient, and they're having a toothache. You examine the patient, and in fact, the maxillary left central incisor tests non-vital. It probes within normal limits, and therefore it's a tooth that could be saved. Then we also examine a periradicular radiolucency that's on the mesial wall as well as it is apically. And so we imagine what that shape would look like in order to successfully save this tooth. There's a sinus tract that we trace that confirms, in fact, this is the culprit and the tooth that needs to be treated and can be treated. And so what I like to do is sit with my assistant, see the shape that's finished, hold that thought, feel it, and say to myself, you got it. And so let's do that. There's the patient's tooth. I want you now to imagine the right shape for this tooth, given that there's resorption, given there's a radiolucency. And so the shape that we imagine is this. Continuously tapering funnel, the walls are smooth, allowing the opportunity for material to flow wherever significant or portals of exit exist. And notice the access cavity. It's appropriate, not too big, not too small. It has preserved the precious ferrule and yet has allowed us enough funnel form to create the hydraulics for a successful result. And we might even imagine further into the future and see it healed. So first of all, we have to make the shape. We make a cone fit. We have a down pack. We have a finish, and there it is healed, just the way we imagined it. Well, we also can do this with multiple rooted teeth and more complicated teeth. And when we do this, endodontics is fun. And then every once in a while, something bad happens. One might call it a temporary setback. And then we try to fix that, and sometimes we go from bad to worse. And this is not good. You know this feeling. It's a feeling we want to avoid, and it's a feeling that we can avoid. This is what happens. If you look at some SEMs, they bend, they break, and this is what the goal, one of the goals, of improving endodontic instrumentation is all about. Well, what if, just imagine, that you could see a patient who had, as you can imagine, crooked root canal system, especially apically. What if you had the confidence to be able to make consistent shapes with relative ease if you pay attention to the principles of endodontics and glide path and making a shape appropriate for obturation? What if you could do this? Well, what's next and how you do this is this presentation. What's next is ProTaper Next. Now I'd like to walk you through the rest of the agenda for the presentation. Having given the introduction, the second part of the agenda will be to discuss the context of this presentation. And one of the parts of the context is I want you to know that I stand in your shoes. At the heart of things, I'm a clinician. I'm not an ivory tower endodontist. I'm not a researcher. I'm just like you. I gotta get the job done. The second part of the context that I want you to think about is in your own technique, each step of the way, to please ask yourself the question, is what I'm going to do next predictable? And then the third part of the context is I want you to challenge everything I'm saying. And equally important, it's important that you challenge everything you're saying. Once we know where everybody stands, then we'll discuss and teach the features and the benefits of ProTaper Next. What is it that sets it apart? Why should I test it? How should I test it? And what is it going to do for me? And what is the technique? And then I have a specific invitation for you to possibly test and integrate the ProTaper into your current system at the minimal amount of inconvenience and risk and that sort of thing. And then we'll conclude. And so this all started a long time ago, and it started with the little guy to the right, Herb Schilder, who was the first to identify specific principles that allowed us not only to do it once, but to do it twice, and do it 3 times, and do it 4 times in a row, and do it next time just because we say so, because we know how to do it. The greatest variable, of course, is us, the clinician. Along these same thought processes were 2 compadres of mine. To the right of Herb Schilder is Cliff Ruddle, myself, and then Pierre Marchetou from Paris 7, Professor Pierre Marchetou in Paris. And the 3 of us had, and Schilder as well, a few things in common, and that was we wanted to be able to consistently make shapes that would allow us success in endodontics. And not only that, we believed in the principle of less is more. We believed that if we could have a lot of principles and just a few tools, that was a lot better than having a lot of instruments and just a few principles. And so out of that, Schilder wrote the books on endodontic clinical experience and how to make shapes and fill these root canal systems in 3 dimensions. And he did this in the 1970s, 1974 to be exact. And what he showed in this illustration is from John Ingles' first textbook, the Old Yeller, some of us call it. And if you look at that shape, I think maybe in a way, this is why I became an endodontist. I fell in love with that look. And some of you might say it's undershaped, overshaped. I believe it's just right. And this was in Ingles' first textbook. The second textbook had this image. And nobody said it, but I figured it out in talking with Dr. Schilder that these were the same patient. And to me, what he was teaching us is not only can you do this clinical endodontics once, but it can be done consistently over time. So here, in fact, in a way, it's 2 in a row. Let's illustrate the Schilder principles of cleaning and shaping. So on the left is a drawing of a root canal system that doesn't have any shape. And Schilder taught us to make a continuously tapering funnel shape, objectives 1 and 2, allowing restrictive flow of material moved apically so that it would seal apically and laterally. Objectives 3, 4, and 5 have to do with preserving the flow or the original contours of the root canal system, as well as preserving the position and the size of the foramina. Having done that, we tried to do this in clinical situations. We didn't have NiTi in those days. All we had was files, reamers, and gates, Glidden drills. So in illustration A, you have an unshaped root canal system, and in B, you would take files and follow to the terminus, and at some point you began what was called serial reaming and shaping. We didn't have NiTi again. So we would take pre-curved reamers and we would slide them short of maximum resistance and carve on the outstroke. On the outstroke. When you think about it, it's the only dentistry ever done on the leaving the patient in a way. But we'd carve on the outstroke and then go to the next reamer, and then we'd go to C. We would recapitulate, sequentially re-enter all those files, and as you did that, D, E, and F, finally a reasonable shape existed. But we didn't have a way to completely smooth it out. And so what happens is when we had endodontic finishes, and these are from the 1970s, so I'm 5 or 6 year old endodontist at that time. On the left, you see the mesial shapes are not perfect at the end. They're just different, bumpy, thin. And the patient on the right was kind of a favorite result of mine for quite a long time. But if you really look at the mesials, for example, they just, well, I guess you would have to say wimp out. They are not robust. And there may even be portals of exit apically that the hydraulics were not able to seal. If we look at this retreatment patient, the post is removed, the gutta percha removed, we discover the missed apical anatomy, we shape it, we pack it. But if you look where the arrow's pointing, instead of having a nice smooth contour, it has a little bit of a bump. Again, it may not be clinically significant, but we never know when cases when results are going to be clinically significant in terms of the quality of the obturation. All we ever really wanted was to be able to take a patient, let's say the premolar is the tooth that needs endodontic care, and that when we make a down pack, we have appropriate shapes and hydraulics which, regardless of the horizontal view, the walls are smooth. This is all we ever wanted. And so we know that these anatomies are complex in terms of the tooth atlas. We've seen this before. And can we make technologies that allow us to duplicate nature's anatomy? And the answer is yes. So it was in 1995 that I'd like to begin the ProTaper story. And this is a story maybe of 3 people, but it's way beyond 3 people. This is a story about a company, a story about commitment. It's a story about starting with the answer. It's a story about a belief, and then it's a story about dedication. And we began to think of what could we do in terms of the Schilder principles of progressive shaping. How could we put that in nickel titanium? And this is where ProTaper was born. And now machines like space-age machines make these things, but the thing I love about this picture is the person on the left is a person. And there's still quality control, one at a time, not one at a time, but quality control, and this is constantly being checked. And this sets these instruments, in my opinion, apart. Still, in 1995, we were concerned that these things could break. You know, endodontists and others can remove these things many times, but it's something we want to avoid, and we can. So in 2001, we launched ProTaper. And basically, we have one shaper to remove the coronal and restrictive dentin, shaper 2 of the middle restrictive dentin, and then connect the dots with the finishing files. On the left is SX, which is a highly exaggerated progressive instrument, short, for short teeth, or for uprighting dentinal triangles on any tooth. And so we began to write articles, and ProTaper, after 3 or 4 years, began to be discovered. And what I always like to say is there's 3 truths, and one is the moral truth, and one is the scientific truth, and the last one is the real truth, and that's the truth of the marketplace. And the marketplace began to speak. But at the same time, I want to emphasize this image, which was taken in 2004 at a tribute to Herb Schilder. He couldn't be there, he was ill. And what I want to make a stand here is ProTaper is not really about ProTaper. It's not about those 3 people. What ProTaper is really about, what really makes the difference, is above our heads there in writing, virtuosity is in your hands. Make no mistake about it. I would say that we could take the finest ProTaper next, and put it in the hands of the worst clinician, who isn't watching this program, by the way. We could put it in the hands of the worst clinician, and they couldn't do a good job. And we could take the worst tools that we have out there, or just old tools, maybe something, the original Naitai instruments, and we could put it in the hands of many of you out there, and you would create elegant, wonderful shapes. The question is, how easy is it? How much confidence do you have? So in 2006, we did expand ProTaper to ProTaper Universal. We made retreatment files, and we made an entire system. But the thing we did notice is that as we taught dentists and colleagues and other endodontists also, what we do and how we do it, and the fun that's involved when you know what's next. And that's no pun intended, but when you know the next skill that you have to do, you know that the outcome you want, you know where you are, and if you're not there, you know what to do different to get there. The thing is, though, we would have doctors take courses, and they did really terrific results, whether it was Cliff Ruddle teaching Pierre Much2, myself, and many others, many others. Sometimes they would call and say, John, that was great, but I can't do it in my town. And what we began to learn is we were doing something different with the instruments than they were doing. And that's what I want to talk with you about now. The first big thing that we're doing different was what we're calling brushing or painting. And this article behind me explains it, but let me show you now. And I even suggest you in the audience replicate what I'm doing. So let's put your left hand up if you're right-handed, and your right hand up if you're left-handed. And you have a rubber stop on your rotary instrument, and you're going to let it run, and I'll show you how I hold the handpiece shortly. Let it run, and short of maximum resistance, paint or brush the wall, let it run, and paint and brush the wall away from the furca, and let it run. And now I'm at the rubber stop, or your apex locator says I'm there, and then you paint your way out, examine the flutes. Dentin in the last few millimeters. That means we just cut that exact shape. So now we flush it, we go through our irrigation protocol, we gauge it, we fit the cone, and when are we done with the shaping? When the cone fits. And so off we go. So that's brushing, as opposed to, or painting, as opposed to scratching. I see some dentists just scratching the walls like this, and you need to let it go and let it come back, paint back, let it go, paint back, let it go. What we're doing is making space for the bigger flutes, and we're removing restrictive dentin when present, and we're designing it just the way we want, away from furcal danger where there's bulk of anatomy. So let's now move to the features and benefits of Next. And I think this is really the heart of what we want to talk about, because if you're like me, I want to know what are they, how do you use them, and when do I use them? So what's next about ProTaper Next? Well, what actually happened next was the third person from the right. That would be Mike Shenamblo. And Mike has been a friend of Cliff and mine for really a long time, and me maybe 25 years. And Mike's been thinking about what's next for a long time. He will admit to me and you that it's been a dozen years it's been on his mind. And what his focus was how can we make files that could maximize safety? And so this was one of the original work that Mike showed. And if you look at that circle in the top right, which is a cross section of the file on the left, you can see that this is a rectangle, not a convex triangle like ProTaper, as I'll show you in a bit, but a rectangle. But how the heck did it get over to the side? Well, by changing the central, offsetting the core. And then now let me explain. If you can, this is a SEM, and it's colored so you can see it. You're looking down the ProTaper Next file, and you're looking at the rectangle as it would exist in that cross section. And when you look at the instrument from the side, it looks different. It looks wavy. It looks serpentine. And when you look at the cross section compared to ProTaper, that's the original ProTaper cross section, you can see clearly that this is a rectangle. Even the walls themselves are not perfectly straight. There's lots of progressive movement. The key here is it's highly flexible, and only 2 points at any horizontal cross-section preparation while we're preparing, while we're following, while we're brushing, are cutting. And that may explain when we talk about that part of the instrumentation or the shaping. So here's the family of ProTaper Next, X1 through X5, and there are the sizes on the right. And then you might ask, well, gee, I want a little bit more taper with the X3, for example, but with the brushing and with the envelope of motion developed by this serpentine, if you will, it actually begins to create a shape bigger than the file itself. So you're not just going to stick them in and pull them out. That isn't the technique. You let it run, brush, let it run, and brush. We decide, you and I decide the shape. So let's look at these instruments closer. X1 is really the X1, 2, and 3 are the bulk of the shapers. And X1, you can see the geometries, X2, and then X3. Recently we were in Switzerland, and we're teaching endodontists there how to use ProTaper Next. And the response by one of the participants was the word enchanting. Now, I've never heard the word enchanting in endodontics or in instrumentation, but I thought that was interesting. This was not one of the features we built into ProTaper Next, but the feeling of enchanting is enchanting to me, because it is the kind of feeling that when we're doing endodontics and it's easy and we're confident, that's the word that comes up. Jeff Coyle, who runs the University of British Columbia, endodontic department. He was once a student of mine. He's a DDS, MSD, PhD. He's one of the smart people in the world. He described this system as slick. So that's also a word I hadn't heard before. Let's look at how these guys work. So on the left is a central core instrumentation. And on the right is the ProTaper Next. And we'll show this in many different forms so you can truly get it. But you can see there's less spots touching on the right in this diagram. And also there's bigger spaces for dentin shaping and shavings and debris removal. If you look at a horizontal cross section, on the top is the ProTaper Universal and below is ProTaper Next. Again, demonstrating that there are bigger spaces in the lower one in between the waves of material because it's offset than above. So there's less spots touching and there's more space. If we look at a artist rendering or computer rendering, I thought this was kind of fun because I was recently in Winnipeg and teaching a group of endodontists the ProTaper Next thinking technique and so forth. And as I walked into the hotel there was this beautifully placed tree which almost said the same thing, kind of that serpentine look. So I thought that was fun. So when we originally made ProTaper, quite honestly, if you ever remember some of those early animations, it showed one curve. And now we've got multiple curves because they are slinky. They are able to follow because of a couple of reasons that I'm going to talk about next. So let's review then the principles of canal shaping. And they simply were and are developing a continuously tapering cone. We talked about that earlier. Flow across multiple planes. Maintain the location of the foramen and keep it as small as is practical. So how have we tried to solve this over the years with nickel titanium? Briefly, if you look at the history of nickel titanium, 1991, you can see there's four characteristics. The one that stands out and should stand out is the radial lands. This was a safe way of making shapes, but it wasn't efficient. In 2001, you can see that there are 3 additions with a ProTaper actually. And the big distinction here was active cutting edges. We wanted more flexibility, more capacity to cut. 2007, huge transformation, changed the status and culture of endodontics with the science of metallurgy. And each file system, of which I thought there were 30, but someone recently said there are 80, so maybe there's 80, maybe there's 30. There's a heck of a lot of them. Each technology, each design has a sweet spot for the kind of metal that they use. And not everyone has discovered that for that metal, for their file, but that's an ongoing research. And now in 2013, really there's something that I think will make a big difference. It's not the answer to everything on earth. All of us can break all files, but these are huge pluses. One is the offset cross-section. 2 is a progressive changing tapers, as we have seen in the wonderful, not wonderful, but the acceptance of a progressive taper instrument. And then finally, the unique asymmetric rotary movement. These 3 really have set Next apart. Let's talk about those 3. So this is a cross-section, horizontal SEM, of course, of profile. And this was what we started with. And it was a very wonderful instrument, way better than trying to connect the dots with hand instruments. We could blend out the shapes and in some cases start early and do all the work for us. But sometimes the work wasn't as efficient as we wanted it to. And then with the ProTaper Universal, we began to see a cutting instrument that truly was efficient. And I think if you just talk to most endodontists, it would be unanimous that what they loved was that they cut. And then now with the ProTaper Next, you can see again, as we showed before, that horizontal cross section, which is actually a rectangle. In cross section, ProTaper Universal is a convex triangle, and notice there's 3 points of contact. The center of the file is in the center and stays in the center. Once there's a revolution with one of these instruments, that shape exists. As opposed to ProTaper Next, where the center of the file, as you can see with the X, stays there, and yet there are only 2 points of contact. And if you imagine looking up the shaft of the ProTaper Next, it does appear to be a serpentine coming at us. It's taking that horizontal cross-section and cutting in 2 points. If we look at simply a static image, on the left you can see that, and this would be true of any cross-section in these files. On the top is Next, on the bottom is Universal. So let's look at the bottom left. You can see 3 red arrows, and that's the 3 points of contact, whereas on the top on Next there's 2. And in the middle, 3 points on the lower, 2 points on the Next up above, and so on the apical area. But regardless of the horizontal section, this is going to be the difference that makes the difference. I'm going to show this to you in animation in a second, but I want to show you what to focus on. At the end on the left is ProTaper Next, the horizontal cross section, and again you can see with the arrows, the small red arrows, the 2 points of contact. If you go 2 circles down, you can see a red arrow about in the middle, so you can see 1 point of contact, and if you follow that down further, you see where it's contacting and further. And this will rotate as we see it in animation. You'll be able to begin to sense where the 2 points are cutting, and there's only 2, and as the instrument rotates, of course, those 2 points of contact continue to cut along the blade where the red arrows are. But where there are no red arrows, there's no contact. If we slow this down, you might be able to see it easier. It's just the points of the red arrow. This is the big difference. And if you look at where the no red triangle, in other words solid blue, that is not touching the side of the shaped canal or canal you're shaping whatsoever. And so we are very specific in where it's cutting, and there are large spaces for removing dentin debris. Okay, let's leave the animation now and go to some SEMs of the instrument itself. And it looks different, doesn't it? You know that it's different, and you know what? It is different. If we now look at this one more animation of the effect of the asymmetric core, you can see that only 2 points are contacting at any given time compared to a fixed taper. So that would be a very specific progressive shaping like Schiller taught us many years ago. We're choosing to shape the canal where we want, as opposed to the instrument telling us. And also, again, we're making bigger spaces for removal of dentin, which we need to remove to allow us to fit the cone. The big thing on the M-wire, of course, is the greater resistance to cyclic fatigue. And this is throughout the literature, and it's been proven time and time again. This really, of course, changed the experience of rotary instrumentation, made it safer, and as you can see there as well, increased flexibility. And so this is another feature of ProTaper Next that was an absolute must to create the performance that we needed, an enhanced performance. Simply an image of a package of stereo X1, 2, and 3s, and that's where I would start with X1, 2, and 3s, and I'll tell you how maybe you can integrate this into your practice and test it out. Motors are dedicated to the ProTaper Next. These are wonderful instruments. The E3 on the left and the ProMark on the right. ProMark has a little bit more range and torque to fit the file, so they're very effective that way. What I want to say though is how you hold the handpiece. And what I would encourage you to do is hold the handpiece between the end of the handpiece and the cord, as if you were holding perhaps a cigar. Or maybe you were just pausing to hold your hands like this. And literally, you're going to cradle the handpiece. Because if you have, or we have, a glide path, no rotary, no glide path, or no glide path, no rotary, no glide path, no rotary, no glide path, no rotary. If we have a glide path, then the work or skill is done, because the design of the metals have allowed us to follow and shape. So really our job is done. We can almost go along for the ride. And I would encourage you to say these words of just let it run and paint, and let it run and paint. If you want to say brush, that's fine. Let it run and brush or paint. But that way you're not trying to get to a rubber stop. You're not trying to achieve anything, because when we try to do something down a path with rotary, then it can be dangerous. But if you just sit back and hold the handpiece, let it cradle in your hand, that could make a big difference for you. It has for me. The motor settings also are important. This is the directions for use are 300 RPM, torque setting between 200 grams centimeters and 520 grams centimeters. And there's a range there, and everybody's going to find their spot. Personally, I would use the higher range because I don't want that instrument talking to me. I'm willing to talk to it, but I don't want it to talk to me. But Mike Shadamblo, who really was the thought process between the offset, he would go with the 200 grams centimeters, and that is for you to determine yourself. There is some creativity here, but not too much. And then one setting for all files. We don't change it in between files. Ilio Baruti has proven this is safer. You can read this in the Journal of Endodontics. And then again, brushing and with the higher torque, we believe, is ideal. Another feature of the ProTaper Next that has been a positive is the handle is 11 millimeters versus 13 of the ProTaper Universal. This allows us to get a little closer to our dentistry, and also you don't have to have the patient open quite as wide. So this has been a plus. So here's the family, X1, 2, 3, 4, and 5. And you can see with the arrows on X1 is suggesting that there's an increased percentage taper as you move up the shaft, as is true also with X2. Starting with X3, however, there's a progressive decreasing taper. This allows you to still brush, make shapes, and still have enormous flexibility. So that's what they look like, and what I would focus in would be on now the sequential procedural path, which in review, of course, is access, glide path, got to have it, take your time in all these, shaping, cleaning, of course, and then finishing. So let's take each of these, showing you the technique for the ProTaper Next. First of all, universal, of course, nothing to do with next, is access that you basically check off. Okay, I'm done. If you're finding you're having to change the access halfway through the shaping, you need to do that sooner. And Cliff Ruddle taught me how to finish and not go to that next step, John, until you have it absolutely perfect. Then you're going to follow that entrance down and begin the glide path. And there should be no restrictive dentin for a small file. The big issue, both in anterior teeth and posterior teeth, are triangles of dentin, which are beautifully illustrated here. These triangles have to be removed in order to have straight line access, and yet still preserving plenty of ferrule. And by the way, the ferrule is most critical where on a posterior teeth? The buccolingual. The buccolingual is where the ferrule is essential, and the triangles, of course, are mesial distal essentially. And you could remove these triangles with rotary instrumentation. An excellent instrument would be, for example, SX. You could use also X1, but the big thing is the concept of removing these triangles before you say, okay, it's time to follow to the end zone. And in this video is an excellent illustration of the value of brushing and allowing the bigger geometries to move easily apically. That funnel at the top on the one on the right, and you can see it on the left as well, that would be our access cavity. And you can see that first 3 or 4 millimeters as the canal simply is brushed north, south, east, and west, but especially away from the furca, furcal danger as Cliff Ruddle would call it, and then just follow and notice that the instrument, through brushing, allows the space for the instrument to follow easily deeper. And that is, I want you to remember that, because That is huge and a wonderful procedural technique that'll make a big difference. Then, of course, brushing. If you look at the arrows, you can clearly see with X1, paint, let it run, and paint, let it run. A lot of us trying to get to that rubber stop as fast as we can, and enjoy it. Take your time. This is where you make the difference. And notice here from a side view also the brushing. You can see the shaft of the instrument is bent as if you were truly painting the wall in your home. And notice again, it's freeing the instrument to easily fall deeper. Validate and verify the glide path. You each should be able to make vertical strokes, first small amplitudes, out the portal of exit, out the constriction, and increase the amplitude until finally we know we own the glide path. We can make a larger glide path using path files. In this case, 1 and 2 were used. There is a path file 3 as well. Or you can move to a bigger hand file. So this is a choice point, and maybe you need to make a bigger space and maybe you don't. When are we done? When is the shape finished? Well, we have to gauge that, for example, X2 dropped to the end zone, and now we flush it and see with a pre-curved 25 file, if it falls and snug, that shape is finished. On the distal, however, we notice that a 25 is loose, and so therefore we would proceed with the X3 and make our shape. Flushing, and you come out, the dental assistant is trained to flush the chamber every single time, whether it's a hand file or rotary. Now we're confirming patency, making sure that it's clear, although it almost always is clear after correct use of rotary, but still we want to be absolutely certain. As far as knowing if the shape is finished, again, when is it finished? When the verifier fits or when the cone fits. And in this instance, we're demonstrating the use of a carrier base, gutta core to be specific. And honestly, when you make great shapes, almost all techniques of obturation are going to be facilitated. Some are better than others. Some are more technique sensitive than others. That's another subject. It's not today's subject. If you're not using verifiers and you're making cone fits, this of course is an extracted tooth from a workshop, that's what it would look like. And so when we look at this novel, unique, asymmetric instrument, maybe this animation shows it best. Please note the tip is staying exactly where it is. There's no movement there. And yet you see these waves. Really what this is Schilder's envelope of motion in nickel titanium. And to me, that's the big distinction of ProTaper Next. Once again, you've seen this before, should be hitting home now, is you're cutting the same efficiency, perhaps more, but you're cutting with fewer blades touching, which in my hands means I have more space to be safe, and also have more space to collect dentin that I want to shape. And of course, you're going to remove these instruments. You're not going to let it sit there. This is animation. You're going to remove them, clean off the flutes, irrigate, and proceed again. Now let's put the features and the benefits of ProTaper Next to the test. Let's see how it performs. First, we do the same thought process. We imagine the result in our mind's eye, and if we're really smart, we might even take a cone beam, discover there's a second mesial buccal. We're going to review the tooth atlas, of which there might be, I think, 30 some maxillary molars, and you just spin them around, really get to know those mesial buccals, for example. And imagine the result, that wonderful palatal shape. The distal buccal usually terminates how? Makes a little hook at the end. And the mesial buccal, how many have 4 canals? Well, about 50%. Oh no, it's more than that, it's 90. Yeah, 90% or more according to Straubko. And others, of course, there's 90% plus orify, but about 50% are separate. But nature doesn't care about canals. She makes labyrinths. So we imagine this labyrinth. We imagine the shape of the palatal. The DB goes a little bit to the turn. How many mesial buccals? Let's just say there were 2. So imagine this. This is all in our imagination. The cone fit. When am I done with the shape? When the cone fits. And let's make 2 mesial buccals. And so there's our image of the cone fits. What's next would be the pack down, imagining that, and then the finish. But we haven't done it yet. Isn't that the fun part? Is now we see in our mind's eye, we start with the answer, we have the right tools at the right time, and we have the confidence that we're going to be predictable. And so let's take 7 quick examples, just simple examples of 7 in a row kind of thing, nothing exotic. And you can see there's a mandibular premolar lesion of endodontic origin. It tests non-vital. Sinus tract traces to the exit, no doubt. And here's the cone fit. And the next picture, of course, is going to be the finish. Slender shape for slender roots, not too big, not too small. Smooth walls, enabling anatomy to be filled along the way. The treatment tooth is right in front of the implant. And when we see, of course, a canal that disappears up high there, we know it's going to branch, as it did in this instance. And this happened to be finished with the X2 and the X3 more in the body. But you can see the canals were beautifully followed, and the results probably two-dimensionally exactly what we want. This central incisor, you can imagine that was a non-vital pulp. The end of the canal is bigger than the incisal part. Pulps die and calcify crown down. And so what we want to do is last principle of Schilder is to leave the foramen as small as is practical. We can't make it smaller. We discover, like in the tooth atlas, that it's a 30 or 40 apically, and yet in the top part it's restrictive dentin. Hence the following and the brushing and the let it run and paint and let it run and paint. And here's the finish, 2 different views. You can see this is a very appropriate shape, and yet there was enough shaping for hydraulics, and we have protected the ferrule, and there's no mistake about that. This is a beautiful, beautiful shape. If I were to do this one over, and as I usually look at patients and say, if I were to do it differently without beating myself up, what would I do next time? And this one I wouldn't change much. Here's a treatment of a premolar, and you can see the anatomy gets canals on different canals. There's lateral canals off lateral canals, and notice the flow is preserved just as we wanted in mechanical objective flow. This patient, you can see now the first instrument to the radiographic terminus. This would be the length that we do our reproducible path, the glide path. We want to be past the constriction in making that, as we showed in the animation earlier. Here's the cone fits, the down pack. And notice these are simple shapes, and yet they appear elegant, appropriate, not too big, not too small, just right. I've said that a few times because the next files allow us to often do it just right if we follow the directions. And then this patient, there was a sinus tract trace to the furca. On the right is the down pack. I want you to focus on the shapes. There's an oblique view of the finish, and here's the patient a few months later healing in the furca, and the sinus tract has closed as it predictably would. Last patient I want to show you is not the one that's there. That is the so-called Coke bottle Gates Glidden look from the past, and you can see the difference by using the right rotary shaping. You can have elegant shapes that allow us a good obturation. So all of these images really have been a convergence of this ProTaper Next technology, examples of that technology. And remember what the convergence really is it's the progressive taper geometries from the original ProTaper concept. It's the offset core, and then finally the addition of the M-wire. And if you want to read more, in the April 2013 edition of Endodontics in Dentistry Today, the shaping movement, the 5th generation technology, led by Cliff Ruddle and then joined by Pierre Machtou and myself. In writing this article, it talks about the generations of technology, and it's an excellent review. And we've talked about a lot of stuff in a short period of time here, and this will make an excellent review. So the question is, John, is this for me? Have you given me enough to move me to do something different? And so what I want to talk about now is an invitation. And there's 3 ways you can experience ProTaper Next. One is to buy one package, X1, 2, 3. Put it on the shelf where you can remember where it is. The next time you are uncomfortable in making your shape, regardless of the rotary instrument system you have, and they all have value to some degree, some more than others. When you feel uncomfortable, uneasy, I don't feel right, then stop, go to find the shelf, the X1, 2, and 3, let it run and paint, and notice what you notice. Okay, so that's one way, one set of instruments. The second one, a little more valid, would be to take mandibular molars, 5 mandibular molars, mesial canals, shape one after the glide path with your current system, shape one with Next, and do 5 of them, and what was good and what wasn't good. The most valid way, and I wouldn't suggest you not do any of these, sometimes it's hard to get the extracted teeth, but a valid way to do this, and I've done this all my career, doing little mini studies, because the best education in the world is our own. I mean, I can talk to you till the cows come home, and you can read articles and listen to the science, but it doesn't mean a darn thing if it doesn't work in our hands, does it? So what I would suggest to you is document this. Start with patient number 1 on Monday or whatever day you choose, a month from now, and treat 10 patients in a row using new rotary instruments of whatever is your preferred instrument system, whether it's hybrid or a singular system. And then just write down your experiences, what worked, what didn't work. And then do 10 in a row with ProTaper Next. Write down your experiences, what worked and what didn't work. You know what? You'll discover the answer for you. And I think that's a valid, honest way of doing it. And remember in the beginning I talked about you want to challenge not just what I'm saying, but what's going on in our own heads. And this is a very valid way to test it, and it's been very useful for me because I've been able to say sometimes I agree and sometimes I don't. Let's review now our time together. We've covered a lot of material, and I'd like to give you some take-home messages. So we began in the introduction that the great endodontic clinician, the masterful endodontic clinician, knows how and when to use what tools and why. And I think we've made some good educational progress there together. In context, what I want us to remember is that we all want the same thing. We want to know that what we're doing is predictable. And we want to know that we can have a result that's going to be positive. And the biggest challenge, remember I said, is to challenge not just what John or others are saying, but what you're saying, because that is sometimes the biggest barrier to learning. We specifically talked and demonstrated the features and the benefits of ProTaper Next. And do you remember the big 3, the convergence? 1 is, of course, the continuation of progressive geometries. 2 is a change in metal, the sweet spot for this instrument, which is the M-wire. And then the 3rd, novel and unique asymmetric central core offset, enables us to cut 2 spots at a time in any horizontal section and leaving bigger spaces for removing shavings and carvings and debris of dentin. Having spoken the features and benefits, I made a personal invitation for you to test these guys out. Give it the acid test. We owe it to ourselves to test new techniques and technologies. The simplest way is just put it on the shelf, use it when you're uncomfortable. The second way is extracted teeth, mandibular molars, mesiobuccal, mesiolingual, pretty similar, good comparison. And then, of course, 10 in a row, could make it 5 in a row, of current technique and ProTaper Next. You'll decide, you'll discover, you'll come, in fact, to your own conclusion. And it is with that that I love this quote from Einstein, because it's totally appropriate right here. And the only source of knowledge is experience. So I've given you some knowledge today, but it doesn't mean a darn thing until you experience it yourself. And what I want to say as I close is it really isn't the end, it's really a beginning. It's an opening, and I look forward to meeting you all on the journey, because for many of us, what's next is ProTaper Next. And I invite you to test drive. Thank you very much.